We are set to pass another dark milestone in the fight against the coronavirus. The U.S. death toll is nearing the 200,000 mark, according to the latest numbers from Johns Hopkins University. The nation also continues to have more cases than anywhere else in the world, with more than 6 million. For more on this, let's bring in Dr. Ron Elfenbein to talk about all this. Dr. Elfenbein, the death toll, it's surreal to think that 200,000 people have died from COVID-19 in this country. I recall in the early days of the pandemic, we used the numbers to, in comparison to lives lost in the wars that America has fought. And as we crept past the number killed in Vietnam of more than 58,000, I recall at that moment people were sort of shaking their heads in disbelief, and now we're at 200,000. It's just remarkable. So the question then becomes, how many more can we expect in the coming months?
Yeah, I mean, that's a really good question. I wish we kind of knew the answer. There's some studies out that postulate that, we're going to pass 300,000, 400,000 by January, by February. It depends on who you read and how you want to interpret the data. But you got to remember that they're all models, and as we've seen before, models are oftentimes wrong. The things going against us right now are the fact that we're coming into the cold and flu season and cold weather in most of the United States, which, of course, generally means that coronaviruses are more active. So, that's probably not a good sign. I wish I knew how many people would be succumbing to this virus. I wish the number were zero, obviously, but I don't think anybody has that magic answer to your question, which is a very good one. But I think that there's different models, and depending on which one you want to look at, unfortunately, though, none of them are really great.
But it is your estimation that more will die.
Yeah, I think that's a given. Absolutely.
Yeah, and as I said, in the years after Vietnam, you and I are close in age, Doctor. This country was so scarred by the loss of those 58,000 American soldiers, sailors, Marines, and yet sometimes when you look at what's transpired across this country now and the attitude that some people have in the wake of these numbers, it's quite a different thing. And as you know, the latest projections from the Institute for Health Metrics and Evaluation show that the number is going to rise. Yeah. So the question, we've sort of established that there will be, sadly, more people who succumb to this. And I don't, this is sort of speculation on your part, but can some of these deaths be prevented? I mean, are we doing enough to prevent another 200,000?
Yeah, thanks for asking that, Vlad. I think, you and I pretty much on a weekly basis discuss this, and that's a simple thing like wearing a mask and washing your hands. I can't tell you how many times I've seen people out and about in large gatherings without a mask, and it is infuriating. It's such a simple thing. Just put the mask on your face. It's really not that much of an imposition, and it's not that big of a deal. Just wear your masks. I think we could conceivably cut that death rate by 20 to 30%, and there's some estimates it's up to 50% just by wearing a mask and washing your hands. And then, of course, the BioProtect product that we've talked about before that you could spray down surfaces with that really minimizes the risk of getting coronavirus. And another tenfold, whatever number you want to look at, but it basically would kill everything on the surfaces so that, when you touch it and then touch your face, you wouldn't be exposing yourself to the virus. So no, I don't think we're doing enough. I think we're becoming more and more complacent, which is amazing to me that as more people die, as you said, we're becoming more and more complacent, not less complacent. And people are gathering more. They're going out to bars more. They're going out to sitting in close proximity at restaurants, having big gatherings in their backyards, not wearing masks. I mean, all these things that are so easy to do to prevent. I think there's probably just an element of fatigue that we're all experiencing that has led to some of this. But I totally think we could be doing more as a country, as individuals.
Dr. Robert Redfield, as you know, made the point during his Senate testimony during a hearing last week that he believed that masks were, at some level, even more effective should a vaccine become available. And as you say, Dr. Elfenbein, it's an easy thing to do. It's almost become, for me, it's like I just have it always with me and take it out when I walk out the door of the house. Even if I'm taking the garbage outside, in New York City, people leave their apartments and you walk outside and you dump the garbage. I'm wearing the mask, and it strikes me as an inconvenience, as opposed to, let's say, having to live in a subway in the underground during the London Blitz. That's a problem for some people. I can see how that could get tiresome if you're doing that, but this is not. So when we talk about the vaccine and the availability for it, how are you? The president has a timeline for the vaccine. Do you buy that timeline?
I don't know. I think it's kind of silly, to be honest with you, to set a timeline on something like that. Science has to do what science has to do, and science takes time. So unless he's maybe privy to some information that I'm not, which is entirely possible, it just seems kind of silly to me to be setting timelines for things that take time to do and that have to be done properly. We don't know how long the science will take. The science will take as long as the science takes. So to set a deadline just seems kind of silly and arbitrary to me. I mean, I guess what he was going for, and I'm not trying to put myself into his head, but kind of like what Kennedy said is within 10 years, we're going to land a man on the moon and bring him back. I mean, I think that's what he was trying to go for. So maybe there's a degree of optimism there that he's trying to put forth. But from a scientific perspective, it just seems sort of silly to me to put a timeline on something like that.
Dr. Ron Elfenbein, always great to talk to you. Thank you, sir. Appreciate it.
Thank you, Vlad. Stay safe.
You too.